Hello, good crowd. We are fortunate here at Rotary International headquarters. Again, we're kind of celebrating World Polio Day and recording some episodes this week. I'm very excited about that. And with us now is Dr. Tunji Funsho, who is a cardiologist, who is the head of the chair of the Polio Plus Committee of Nigeria of Rotary International. This is going to be a great conversation. You don't want to miss it, so stick around.
Welcome to the Your Mark on the World show with your champion of social good, Devin D. Thorpe.
Our sponsor, Johnson & Johnson, matches most individual donations up to $250 at caringcrowd.org. Tunji, welcome to the show.
Thank you very much for having me.
We're thrilled to have you. So grateful that you would make time for us. How did a cardiologist trained in London end up running the Polio Plus program for Rotary International in Lagos, Nigeria?
Well, once you volunteer as a Rotarian, you can become a lot of things. You can become a teacher, a painter, a farmer, a trash collector, and so on and so forth. In my own case, I joined Rotary in 1985 because I was attracted to what Rotary does. And as time went by, polio became a very important part of our program. As a matter of fact, it was the year I joined Rotary that the program actually started, that the issue of raising funds at that time was expected to be $120 million US. And of course, we all know how much we've spent since then,
yes.
how much time
billions and billions.
And so from that time, I've been very much intimately involved, with our Polio Plus program. And as the year goes by, you appreciate the fact that yes, you can save a few heart attacks. You can, in the ICU, you can literally bring people back to life when they have a heart attack and so on. But when you look at that against the backdrop of the number of cases of polio you can prevent, and we have prevented in the last 30 years or so, we have about 16 million cases prevented from paralysis and still counting. The return on investment is much higher with polio than sitting in an office as a cardiologist. So that is how gradually I got sucked into it, and eventually I was asked to head the Polio Plus program in Nigeria. And here we are.
Here we are. It is remarkable work that you're doing, and the polio infrastructure that you've led and helped to create has been hugely impactful. A few years ago, there was a terrible outbreak in Western Africa of Ebola. And that affected mostly some neighboring countries to Nigeria that were much smaller.
That's right.
And when a few cases of Ebola popped up in Nigeria, it really sent shivers, I think, through the global health community entirely, right? Because Nigeria is a huge country.
Understandably.
And had we had an epidemic of Ebola in Nigeria, like we had in Liberia and some of the other countries, it would have been horrible. It's part of what happened to prevent that was leveraging that polio infrastructure to prevent the outbreak. Tell us how that worked. How did polio infrastructure, and you and your colleagues, how did you contribute to preventing a real epidemic of Ebola in Nigeria?
Yes, it will have been a major catastrophe, not only from the point of view of stopping Ebola, but of diverting attention and taking resources away from polio eradication. One of the major things that have helped us get this far with polio eradication in Nigeria is the formation of the Emergency Operations Center for Polio. This is a center where all partners, technical people, converge at least 3 times a week to look at the program, see where we are, and plan for the future. That structure has helped us reduce the incidence of polio in Nigeria very dramatically. It came on board about 10 years ago now. Mm-hmm. And that structure, had produced a lot of people with experience in outbreak responses.
Right.
Because we, as you may be aware, we've been having a few cases of vaccine-derived polio across Nigeria, mm-hmm. across a lot of countries in Africa, Central Africa, and parts of East Africa. So we had people on ground who were trained, who were ready to be mobilized. So as a matter of fact, the deputy manager of Polio EOC was the one who was seconded to go and head the Ebola EOC. And so it was the same structure that was used. Essentially, it was the same technical people from partnerships who were seconded, to work with him, to use the same kind of modality of contact tracing, diagnostics, to ensure that it doesn't spread beyond those few areas where we had recorded cases of Ebola.
Yeah, it is remarkable that, and so important to think about all the lives saved because of the great work you were doing on polio. Of course, in your work, nothing can be more exciting than the fact that we are now looking at having passed the 3rd anniversary of the last case of wild polio in Nigeria, and people are talking about Nigeria being declared polio-free. It's a huge milestone. Yes, of course, you've led that effort. Tell us a little bit about what that means to you.
There's a sense of, being gratified that you've put in so much effort. Of course, with a lot of, support from Rotarians in particular, but also our partners, WHO, UNICEF, CDC, and the Bill and Melinda Gates Foundation. It gives one the sense of satisfaction that you've made a promise, you've had your ups and downs. In fact, if you recall, we were 2 years without polio in 2016 when suddenly we had a resurgence in the Northeast. That we have been able to go beyond the 2 years and get to 3 years, and we are now looking forward to certification. Gives one a cause of joy, some relief, but at the same time, the understanding that it's the beginning of another new phase of the program, keeping Nigeria at 0 cases of polio. That may be a little bit more daunting than when we're facing cases of polio and we can tell people, well, we still have this challenge.
Yeah.
We need to do so. But now that we've crossed that 3-year milestone, it may be a little more difficult to garner resources from both, governments around the world and also from the government of Nigeria at every level.
Yeah.
To continue.
Right down to the community level.
That's right.
Yeah.
That's right.
That is a challenge. One of the interesting things, and you alluded to this, is that there was a 2-year gap in cases in Nigeria. In fact, the World Health Organization excitedly announced that Nigeria would no longer be considered an endemic country. It was polio-free, and shortly thereafter, the cases returned. I expect that this is creating a bit of caution around making that declaration of polio-freeness again.
Right.
What are the lessons that you take from that experience that apply to our global polio eradication efforts?
I think the experience we'll learn from that is, number one, to ensure that the infrastructure we have created continue to work stronger, and that we don't take our eyes off the ball. The numbers of vaccine-derived cases we've had in recent times, as unfortunate as it is, because some children are paralyzed, is a wake-up call for us. That even when we get certified polio-free, we have to ensure that the level of routine immunization coverage is improved dramatically the way it is in most parts of the country. Some parts of the country, we're doing pretty well, 80% and more. For some part of the country, we're still at single-digit level. It's the lesson we've learned is that we have crossed one milestone. As I always tell people, we have 2 more milestones to go. The next milestone is for WHO, African Regional Committee for Certification, certifies Africa polio-free. By extension, Nigeria removed from the list of polio endemic countries. And then, of course, when we're able to see 0 cases in Afghanistan and Pakistan, we will now get certification for the world. At that point in time, it's when we can sleep with our eyes closed.
Yeah. It will be critical, of course, for us to feel like that certification is meaningful in the sense that it's correct. How do you? I mean, you're a doctor, so you can answer this question authoritatively. How do we know that we really have reached the milestone, that we haven't fooled ourselves?
Well, that is why WHO is a little bit, and the African Regional Certification Committee are cautious and are doing a lot of due diligence work at every level of government, at the federal level, at the state level, and local government level, looking into records, looking at structures on ground, looking at how robust the surveillance system is, such that any case of paralysis that is picked up, number one, is picked up, and is picked up and investigated as according to the protocol, collecting stool samples, sending to regional labs. We have 2 in Nigeria. And if they find a case of positive for either wild polio virus or vaccine derived, it goes to CDC in Atlanta for typing and confirmation and so on. So we are ensuring, that the need or the possibility of a resurgence of the wild polio virus in particular is much less likely if all these things are done before certification, than if there are gaps in these structures. After certification, we get a case of wild polio virus.
Yeah. You mentioned surveillance, and that's such an important aspect of this. It's the tracking of polio cases, but also tracking the virus in the environment. So WHO and other partners are taking samples mostly out of sewers, right?
Precisely.
Tell us a little bit about how important that is in Nigeria and elsewhere.
Well, the polio virus is as much as it's not a very strong virus, it has resilience in circulating the environment where the level of immunity of children is low. So not only looking for paralysis in children, but also making sure that the virus is not in circulation in the environment. And of course, we know where it thrives well, where it can easily be found, is in sewage. And sewage in areas that are high population, low level of hygiene and sanitation. So WHO will earmark certain areas, and also from time to time, depending on the epidemiology of the last case of vaccine derived, for instance, that is required, they may increase the number of areas. So they collect these samples on a regular basis under stringent conditions and send it to these same labs. And those labs will tell us whether there's any environmental sample that is contaminated with either the wild polio virus or the vaccine derived polio virus as well. Because as long as there are children that have no immunity or low immunity, then there's a danger to the children of having these viruses in the environment. So it's futile just checking in the child when the virus is lurking in the sewer, waiting to get to that child who is not optimally immunized against polio.
Yeah. As you think about polio from a medical standpoint as a doctor, one of the fascinating things about polio is that most people who are exposed to it, who in fact get the virus, who get sick, don't develop paralysis. And so no one knows that they've had the virus. And that's only 1 in 200 or so gets paralyzed, right? So
Precisely.
what are the implications of that in fighting to bring about polio eradication?
Well, the implications are, fundamentally that you have a lot of what we call healthy carriers, like we have in a few other diseases. And so these healthy carriers can easily disseminate the virus in an environment. And it's not just children, adults. This is why some countries like Saudi Arabia, when people are going for pilgrimage, adults are immunized at the airport against the virus. And a lot of times, some of the reintroduction of the virus into environments like we had in Syria some years ago are done by adults, jihadists, who have moved, from Pakistan, to Syria, and shed the virus into the environment. And of course, because of the war, which immunization coverage was low, and children, got the wild polio virus and got paralysis. So, like I said earlier, it is not a very virulent virus in sense of causing paralysis. It is a very good immunogenic virus. In other words, it will raise immunity very quickly in people who are exposed to it, who have a very good level of immunity generally. But when it gets to weak children, malnourished children, then it finds a root and causes, paralysis.
Yeah. So in other words, it is a poor tax because it mostly affects more painfully, more acutely, people who are already in a difficult situation.
That's right. It goes for vulnerable children.
Yeah.
Vulnerable children in the sense that, number one, they live in environments that are unhygienic. They also are poorly, nourished. They will come usually from poorly educated parents, particularly poorly educated mothers. The source of, water is contaminated. By extension, the source of food will be contaminated as well. So it goes for vulnerable children, and that is why the approach, to our program in the Plus is actually having nutrition programs, which is mostly run by UNICEF. In environments, where we have high incidence of polio, we have, in addition, nutritional programs to ensure that these children's level of nutrition is high, therefore they can produce immune cells that will protect them against the virus. Otherwise, we give them vaccines. There's not enough proteins in their system to help them produce, adequate immunity against the virus.
Let's talk a little bit more about Polio Plus, the plus in Polio Plus. From the outset, in 1988, when Rotary launched its polio effort, it called it Polio Plus. There has always been a plus, but it seems to me there is growing emphasis on the plus in 2019. What are you seeing?
Well, because the program has gone on for so long, at least in our communities, and the vaccine is provided free of cost, to the families, unlike most, other medications. And our primary healthcare infrastructure is not very strong. They find that we are badgering them with the polio vaccine, yet they don't have antimalarials, which they encounter every day in their children, which cause quite a bit of mortality. They don't have drugs for diarrheal diseases. And they say to us, well, we don't have polio now, give us drugs, for malaria. Give us oral rehydration salts, for our children when they have diarrhea. So we evolved a system that we call health camps, which is actually running primary healthcare facilities around the same time that we're doing supplementary immunization activities, just providing the basic drugs, antimalarials, antidiarrheal agents, ointments, for infections of the skin and so on, analgesics, multivitamins, so that when families, come to this, of course, we all know, the main users of primary health care are mothers and children. Obviously, when they come with their own illnesses, they bring their kids along with them. So we treat the mothers and other children, and then we pick the children below the age of 5 out of the queue and give them the oral polio vaccine. So that is one of the methods we have used. We also know that these communities lack potable drinking water. So the program also provides, funding to erect solar-powered boreholes, sometimes hand-pump boreholes, depending on the population, to assist, to ensure that, and like I said, we have these nutritional programs. Rotary now, it's supporting infrastructure for routine immunization. Because at the end of the day, the end game will be dependent on raising the level of coverage of routine immunization to at least 90%. Because once we do that, then the need for doing supplementary immunization activities will become, much less or even non-existent. So the pluses have become a very major part of our program, as we have gone a very long time in the program, and people are saying, well, yes, we have not seen any polio in our community for the last 3 years, so why don't you give us this? Why don't you? In fact, some go as far as saying, build the roads that lead to our villages, as a political statement to the government, really, not to the program itself. And somehow they get their attention, and we Rotarians, because again, there are issues of accessibility.
Right.
The easier it is for them to either get to the static health centers or for outreach programs like, SIAs to reach them, the easier it is for us, to reach them with routine immunization or SIAs, and the easier it's of course to them also to come to the nearest, city to benefit, from static primary healthcare centers.
As you reflect on your time as a Rotarian, now 34 years in Rotary, and that entire time, eradication of polio has been a goal. And just recently, just now, really, we're reaching the milestone of having eradicated polio in Nigeria. I guess we should be careful. It hasn't been declared yet.
That's right.
It's been 3 years without a case. We're being cautious for the reasons we talked about before. But how does it feel to be on the cusp of that achievement after all these years working for it?
I think the program has lasted so long that at some point in time, some people, I'm not one of those people, felt that we're wasting our time. And I think, I can now thumb my nose at them. I say, you said we can't do it. Now we've done it. So there's that triumphant feeling about it. Again, there's the aspect of us finally, seeing the light at the end of the tunnel, because we've made a promise to the children of the world that we're going to eradicate polio. Initially, we gave a time frame because that was the advice we got from the experts. But of course, the polio virus, has other ideas. But the important thing is that we have gone from such a high level of polio cases when we started in 1988, of 125 countries involved, 1,000 cases every day, to just 33 cases last year, the whole of the year. And just 2 countries actively transmitting the polio virus, in Nigeria still to live. So we've come a very long way, and so it is a very gratifying thing that we made a promise, and we see that that promise is gradually being fulfilled.
It really is an incredible accomplishment. Such accomplishment requires incredible superpowers. What is your superpower?
Well, my superpower emanates from, my belief that what's the mind, and in my vocabulary, I interchange the mind and the soul. what it can conceive, it can achieve. And the most difficult part is that conception. Once you conceive an idea, and throughout world history we've seen that. Once you can conceive an idea, that's the beginning of the process. And like Lao Tzu says, the journey of 1,000 miles, takes that one first step. Once you can conceive, take that first step. Don't worry about the end, it will come. And in our own case, we can see that it is coming.
Well, Tunji, thank you so much for taking the time to be with us today. This has just been a great conversation. Before you go, would you just tell people how they can learn more about polio eradication, especially in Nigeria?
Well, our website in Nigeria is endpolio.ng.org. It's updated regularly. And of course, overall, you can find, on rotary.org/endpolio now, a lot of information at the international level. We're also on Facebook and on Twitter. And as much as possible, people can also send us, emails at rotarypolioplusnigeria@gmail.com.
Fantastic. Well, Tunji, thank you very much for being with us today. We wish you every success in the incredible work you're doing. Thank you.
Thank you for this great work you're doing on our behalf as well.
All righty. Let's do some good.
At Caring Crowd, we believe everyone has the power to make a difference. Through our crowdfunding platform for community health, we empower passionate people to drive real change. Whether you work for a nonprofit organization, volunteer, or want to get involved for the first time, you can post a campaign on Caring Crowd. Join us, because caring is where change begins.
Thanks for tuning in to the Your Mark on the World show, the Social Impact Podcast. Please subscribe via YouTube, iTunes, Google Play, Stitcher, or Spotify.